Hello everyone, I'm a nursing teacher. I'm very happy to come and learn about myocardial infarction with you today. Today's course online include we will talk about heart function and what is myocardial infarction and who is prone to myocardial infarction and what are the symptoms of myocardial infarction. And finally, we will talk about prevention for myocardial infarction. First, let us understand the function of the heart. The heart is like a pump that pumps blood throughout the body by releasing and contracting to supply nutrient and oxygen to tissues and organs. However, these important movements of relaxation and contraction require healthy myocardium. You can watch the picture. The heart, when the heart releasing, we talk about the diastole. In diastolic period, the heart collects oxygen-deprived blood from throughout the body. And then when the heart collects all the blood, and then start to, we call the systole. When the systole period, the heart pumps oxygenated blood throughout the body. And whatever the diastole or systole, the heart must be contractility. And the contractility ability depends on the healthy myocardial function. And next, let's look at the ranking of the top 10 causes of death in Taiwan in 2022. The number 1 is cancer. Number 2 is heart disease. Number 3 is COVID-19 in the past 3 years. Number 4 is pneumonia. And number 5 is cerebrovascular accident. Number 6 is diabetes. Number 7, hypertension. Number 8, accident injuries. Number 9 is chronic lower respiratory tract disease. Number 10 is kidney disease. You can find, as you can see, heart disease ranks second. Many people die from heart disease in 2022. We understand what is myocardial infarction. And we talked before, the heart, the function depends on the healthy myocardial function. So when the blood vessels supplying the heart become clogged, so they cannot normally supply nutrients and oxygen to the heart. So the tissue and the organ will not receive the enough blood. The heart will be ischemic and the severe myocardial necrosis will occur. So we call the myocardial infarction. It means the heart myocardial cell is all death. They cannot work another and they work another continually. Eventually, the heart becomes unable to efficiently deliver blood to the entire body. So the whole body, tissue and organ will not receive enough blood. So then they maybe cannot work anymore. So we understand what is the myocardial infarction. It means the myocardial cell is dead. So the myocardial cannot supply the heart to do the contracting work. And then let me find who is prone to myocardial infarction. First, when you diet, always eat high in saturated fat. Food high in the saturated fat include like animal fats, such as butter. The second is if you excess alcohol consumption. The alcohol will induce the vessel contraction and decrease the blood supply to the vessel. And then the heart will get not enough blood. And the third, if you don't like exercise, you physical inactivity, and you will maybe easy to get the myocardial infarction. And next, the cigarette smoking. The smoking the cigarette also can induce the vessel contraction and to decrease the vessel blood supply. And obesity. Obesity means it's overweight. When you overweight, you will increase the heart workload. And in the continue the work, if the heart work long a period, they will not enough to supply the blood enough to the tissue and the organ. And finally is genetic. Maybe in your family, your parents, they got a myocardial infarction or other heart disease, and you were easy to get a myocardial infarction. And we, in some research, find the age. That means is elderly, old age, the easy to get the myocardial infarction. And we also find the male is easy to get the myocardial infarction or other heart disease. Next, we talk about when you got a myocardial infarction, what are the symptoms you will find it? The first is popular, is we call the chest pain or chest discomfort. You will feel the chest like a stone, like a heavy stone to press in on your chest. But the chest pain is induced by the heart vessel ischemia. So it's a ischemia, we call ischemia pain. The second is shortness of breath. You will feel the hard to breathe. The breath rate is increased. In your heart, in the vessel is not enough blood. So your heart will not get enough oxygen. So your lung will, by increase the breath rate to breathe more oxygen. And the next is pain or discomfort. We talk about the chest pain, but your pain will radiate to the jaw, neck, back, arm, and the shoulder. So your pain not just in the chest, maybe in other of body part. And finally, you will feeling nauseous or vomiting and light-headed. And you sometimes always feel usually tired because your body, they cannot get enough blood and the nutrients. We talk about the myocardial infarction and who could easily get myocardial, but the myocardial can be prevented. So if you prevent this risk factor, you will avoid to get a myocardial infarction. You will get a healthy heart. The first, you must be start smoking. We talked about before, the smoking the cigarette will damage the heart vessels. So you will easy to get a myocardial infarction. So you must be to stop smoking. And the next, you have to choosing good nutrition. You have to balance diet, not focus, not eat too much the high saturated fat, especially in animal fat. You will eat more vegetable and find like the whole meals and other fruit, but you cannot focus on the too much fat, high fat food. And next, you must be start to exercise. Being regular every week, per week, have at least 3 times you have to exercise, do some physical activity. But the more is good is being physically active every day and regularly. And we talk about the obesity is a high risk for to get a myocardial infarction. So you aiming for have to control your weight to keep a healthy weight, a good BMI. And sometimes you have to control your emotion and let your work and life is low stress. So reducing stress can decrease the heart loading, and you will get a healthy heart. And limiting alcohol consumption. Limited alcohol, we talk about alcohol, will also, like the cigarette, can damage the heart vessel. And the next, make sure you get enough sleep. A good rest is good for your every, not just heart, it's every organ and the tissue. there must be rest in the night. So you have make sure you get enough sleep. And finally, if you have a hypertension, the hypertension is a non-healthy vessel. So you firstly, if you want to prevent you got myocardial infarction, you must be lowering high blood pressure. So do you understand what is a myocardial infarction? So today we understand about the heart function, and we talk about what is myocardial infarction, and we talk about what are symptoms of if you got the myocardial infarction, and finally very important, how to prevent the myocardial infarction. So I hope you have a happy learn today. Thank you. Bye bye.